Welcome to Great Online Training. This is Naidu. I'm a SAS trainer and programmer. In this video, I'm going to explain a series of videos on SAS clinical programming interview question and answers. The next question is, what is CRF and what are all the things you can find out in the CRF? In each and every data set wise, what information you will get it. Basically, what you meant by CRF? CRF is a case reportive form. This is how we collect the information from the patients. So this is like a A4 size paper, so which is stick to your what I can say, nurses or maybe the investigator, whoever the doctor, they'll carry this one. What you will have it in this particular document is, you will have a site number, that means the hospital number. As it is our clinical trial, let's say if it is multi-center, so that different hospitals, they are doing a clinical trials, so my hospital number is going to be 01. Subject number, so in this particular hospital, I am the first person for this clinical trial in this hospital, so that 001 I will get it. Subject initials, let's say Naidu, NDU or something like that, you will get it as a subject initial. And this is the demographic information. If the persons ask you what you can able to find the demographic data sets, can you just tell me what information you can find out in the demographic data sets? Means very simple. Site ID, subject ID, and date of birth, race, ethnicity, or gender. That's it. You no need to tell any other answers. So whenever they are asking what variables you can able to find out in the data set of demography, means in the demographic data set you will have a birth date, that is your date of birth, ethnicity, and as well as gender, you can able to get it. And we are coming to here the more information. So there is one more data set called SU. SU means substance use data set. So substance use means what substances they are using it. They are using any alcohol, they are using any tobacco and all. So that information will be captured under SU data set. All this information from the CRF will go and settle into a data set called SU data set, substance use data set. So every data, every protocol and every CRF page will have the common things are site ID, subject initials are the very common stuff in every time. So now you can see that alcohol usage, so that is going to be a variable in that. So in which variable it is, scores is a variable. In that you will get it never consumed, previously consumed, and currently consumes and all. So whatever your belongs to, suppose this particular page is one patient for one particular page like this, okay, per one visit. Let's say if the patient multiple patients, so that multiple papers, if imagine this particular same thing to be calculated, maybe to be captured around 4 times, so that 4 pages per a person you will have it. So that means, so each particular information is going to be one record for you in the data set. So if they are asking what is the substance use, means alcohol used, tobacco used, and date of diagnosis, and all the information you can able to get it. Apart from that, so what is the all the information you can able to get it here. And we are coming to the medical history. What is the variables you can able to find out the medical history? Means you don't tell that again site ID, subject number, subject initials and all. It is a very common in all the clinical trial protocol on this particular CRF pages. You need to tell that is that medical history has taken, none are taken. Okay, is that there is no medical history for that patient, they'll go for select patient as a none. When it is the patient is not suffered with any other existing conditions, so mostly the patient will not have any record for that. Imagine if they are tick marking this one, so the patient will not have any medical history information. Imagine they have not tick marked it, they filled this form, then they will have a what is the medical history sequence number. That means imagine the first one is stomach pain, regularly I'm having a stomach pain. Second one is regularly I'm having a stomach acidity, and the third one I'm having a headache. Fourth one, I had a surgery in 2017 due to appendicitis, or something like that. They can able to find out all this. MH sequence means the sequence wise all the side effects what they have already faced and what medical conditions of those persons you can able to get it. That is going to be MH term. We call it as a what term it is. Stomach pain is a term. According to the dictionary coding term, that is your preferred term. Okay, PT term, you will get it MH bodies is that is your SOC system organ class, how you classified it on all, you can able to get it. And apart from that, you can get it what is the start date of that particular medical history, and what is the end date of that medical history, and is that particular medical history still ongoing. Let's say the person is suffering with cancer, the person diagnosed with the cancer, and the doctor said in 2017 itself you are suffering with the cancer. So then the start date of that particular cancer, mostly the cancer is not ending, so that it is going ongoing. That means it is not at cure date, it is still ongoing. Is there any certain events happen before of clinical trial but still continue after clinical trials, or maybe till into the clinical trials also? Those are all comes under ongoing medical history events. So if somebody asks you what is the information you can able to find out in medical history, means medical history sequence number, medical history term, and what is the start date of the medical history, is it what is the end date of the medical history, is this particular medical history is ongoing or it stopped. Okay, so that information you can able to get it in medical history. Vital signs, if they're asking, can you just tell me what information you can able to find out in vital signs, means vital signs means that is your blood pressure, heart rate, respiration rate, temperature, height, weight, BMI, all comes under your vital signs. Okay, so all this information, suppose if they're asking what is the variables you can able to find out in vital signs data set, is means VS test CD, and VS test CD, within the test CD itself, SBP means systolic blood pressure, DBP means diastolic blood pressure, VS test CD pulse means pulse rate and respiration rate, VS test CD equal to BMI and weight and height. So it is for one person. One person, let's say the person is 001, will have one patient for multiple records. One record for diastolic blood pressure, another record for systolic blood pressure, another record for pulse, another record for respiration rate, one other record for temperature, another record for weight, and another record for height, another record for BMI, and all you will get it. So multiple records per a person you are getting it, because one patient will have a multiple records in vital signs data set, because multiple what are parameters they are collecting. Let's say it is for visit one. Let's say they are asking you to calculate this vital signs around, as is explained in the earlier question, that around 6 times we need to take a BP, so that like this per patient 6 times of these pages will be there, so that one patient per one visit we will have a multiple records. So per patient, per visit, per parameter, multiple records is there because of the visits. Different visits have a different things you can able to get it. So this is all the vital signs of the patient's information. We will capture it from this particular document. We are coming to here, laboratory data set. So what you can able to find out, is that lab done for him or not? First of all, is that laboratory tests are done or not done? We'll just go for it. Then what is the lab test? The lab test is glucose or blood urine or nitrogen, whatever it is. So creatinine or chloride, whatever it is, and you will get it, the test done or not, what is the results, what is the units, what is the specific units, is the particular lab test is clinically significant or non-clinically significant, you will get it. Based on this particular variable, few more variables you will derive it in your data set, like a reference ranges you will derive it, and SI units you will derive it, when this particular date of this particular glucose event has taken, and what is the start date and what is the time, and all everything you can able to get it in data set of lab data set. And within that lab you have another thing also, like a hematology wise. So hematology wise, like a hemoglobin, hematocrit, RBC, platelets, WBT, neutrophils, lymphocytes, monocytes, and all, is that what is the results of it, is it clinically significant or non-clinically significant, and all you can able to get it in this. There is a one more called coagulation. So coagulation CRF also, that means is there any precipitation happen after giving this particular drug. That means in latest studies, when we are looking into this particular COVID vaccination, after taking the Covishield, few people are getting blood clots and all in the blood, so because of this particular side effect of this particular vaccination. So those things you can able to get it in a coagulation here. Okay, that information, is there anything happen like that, is there any precipitation formed, in precipitation formed within how many seconds it is, those things you can able to get it here. And urine analysis, like a pH in a urine and a specific gravity in urine, is there any proteins in urine, is there any glucose in the urine, and what is the content, how much it is, all those things you can able to get it. All the information will go under that particular data set called laboratory data set. And there is one more data set you can able to see here called dose administration. That is your dosage data set. Okay, ADEX we call it as a data set name, exposure data set. How the exposure is, when the patient came to the visit, if it is a visit 1, in what date, how many pills or maybe tablets has given, and how many are written given. Suppose we said a patient to take around 20 pills, but patient has consumed only 10, remaining 10 he is returning it. So when he is returning it, and what is the date, what is the compliance means total, if the patient all the 20 tablets he swallow, so that 100% compliance. Maybe only 10%, 10 tablets only consumed, so that 50% compliance you will get it. So like that, all the reports you can able to get it, this information. Okay, all the dosage information you can able to get it in exposure data set, you can able to get it all the dose information. And we are coming to end of study. This is going to be your DS. DS means a disposition data set. Disposition data set, we will ask a question to the patient. Did the subject completed this protocol? Okay, this particular person has completed this clinical trial, yes or no? So then if they select it, then it will go for it, that data. Is that when that particular patient is completed or withdrawal? Suppose total 300 members are participating in the clinical trial. All the 300 members, maybe they need to complete, or maybe they need to, some of them they may be withdrawal in the some time in the clinical trial itself. So then when if they withdrawn, what is the withdrawal date? Or maybe completed, what is the completion date? Or maybe a date of last dose. So when the person has taken a last dose before completing the clinical trial or before going for the withdrawal of a clinical trial. So what is the last dose? You can able to get it in the data set called DS data set. What is the primary reason for discontinue? Suppose the person is discontinued. Okay, what is the primary reason for discontinue? Because of the adverse event the person is discontinued, or lack of efficacy, that means the drug is not working on him, that's the reason why he is just discontinued because of that in this particular drug. Or else lack of compliance, because patient we said 20 to take a medication, 20 pills to be swallowed, only 10 has taken, so that lack of compliance, but that's the reason why the person is withdrawn, or that subject or legal guardian is withdrawn. Suppose if it is in a, let's say it is in a pediatric trial, so what happen is maybe the parents are not interested to continue in the clinical trial anymore for their kid, so then they are just choosing that, okay, the patient parents are not interested to continue in the clinical trial because of that reason. Or is there any protocol violations are happen, specify those. And last to follow up, because you taken a decision on the first day itself in the baseline, from there onwards he is not parting in coming to the clinical trials and all, because of that reason he is discontinued into the clinical trial. Or maybe a death, so the person is met death, so definitely he will not come to the clinical trial. If the person having a death, when the death date it is, so that you can able to get it here. And apart from that, other specify, apart from this particular mentioned reasons, any other reason is there, we need to specify that other reason here. So when that particular investigator has signature to complete this particular all this form, so this is called end of study document, or we call it as a disposition data set. So all this information, when the patient is completed, when is the last dose, and all the information you can get it in disposition data set. So that information you can able to get it in disposition CRF. There is a CM data set, concomitant medication data set. Okay, the patient has taken a drug, from there onwards the person is suffering with some other medical conditions. Let's say okay, vaccination, you take a vaccination of Covishield, the persons are taking a Covishield, but because of the Covishield they are getting some side effects. Those side effects information, to get that side, let's say the person has taken a Covishield and they are getting some side effects, that side effects to be reduced, doctor has given some medications. Those medications we call it as a concomitant medication. Let's say Covishield, person is taking suffering with stomach acidity, maybe Gelucel they have doctor has prescribed for him to reduce that stomach acidity effect. So that Gelucel is going to be a concomitant medication. Is it a prior concomitant medications? And what is the, how much, what is the drug name? It's a Gelucel. How much dose it is? They have asked you to use it around 5. What is that? ML? Yeah, that is ML. Frequency, how many times per day? That is your 3 times per day. They said that. What is the route? So if it is an injection, maybe because of that stomach acidity, if they are giving any injection, so that is it going to be intramuscular or intravenous or maybe oral. So as it's a Gelucel, they need to take in from the route as a oral indication. So what is the indication of that particular drug, and what is the start date and what is the stop date, when that particular concomitant medication you are stopping it. Okay, you will not continue that taking a gelusil every day, right? After that particular side effect is gone, then automatically you will stop it when you have started taking that gelusil, when you have stopped it. Like that, there will be a plenty will be there for your concomitant medication in your CM data set. And again, you can able to see here adverse events. What is this adverse events information? Like a, is that particular patient having an adverse event or not? See, all the patient, it's not necessary that having an adverse event. Some people will not have, some people will have it, and some people will not have it. Okay, the adverse event, what is the adverse event name, when that adverse event happened, when that adverse event ended, what is the seriousness, is it a serious or non-serious? Serious means the patient is going for any of these reasons. Okay, if the person is said yes, yes means if the patient is what I can say, prolonged hospitalization, or maybe if the patient is leading to coma, or maybe death is comes under serious. Is this particular adverse event happen because of that particular drug? Is it a seriousness, very serious? That means when it is serious, the person is prolonged hospitalization, or maybe the person is dead, or maybe the person leads to life threatening any diseases, will becomes under serious. Intensity, nothing but severity. If you are measuring it, all the people who are serious will be severe only. Okay, but some of the people will but they are serious, some of the people they are not serious, but still there comes under any of these category, maybe mild or moderate. So somewhere they will come onto this particular intensity, that is your severity. And relationship, if the person is met an accident on the road, that the person is not related to this particular clinical trial at all. So that means, what is the relation to this particular adverse event happen, the person having a death because of the accident, not because of that drug? So is it related to this particular drug or not related to the drug? You can able to get it by just using this particular option called AE-REL. AE-REL means what is the relation to that particular side effect to the drug. If AE-REL equal to 1 means unlikely related, 2 means possibly related, 3 means completely related, or something like that. You can able to get it. What action has taken after getting this particular adverse event? None, no action taken, or maybe interrupted. Maybe sometimes what happens, they stop giving a dosage to the persons, so that you can able to get that information in dose interrupted, or maybe reduced. Maybe they are giving initially 450 mg, now they reduce it to 150 mg now. Okay, the study medication, because of the person is getting a lot of side effects, they are just going. Or else fourth one is the person is getting a lot of side effects, so the doctor has decided to discontinue this particular person from the clinical trial. So which one they have selected? So this is all per patient, per visit. Here you will not have any visit information in adverse events. Okay, so here we never know, right, when the patient having a side effects and all, we never know. Okay, so we'll not have any visit information. Per patient, per parameter, that is your parasite effect, there will be a multiple records. Okay, per patient, multiple records you can able to find out in AE data set. What is the other actions taken? None. Medication has given because dose interrupted, and at the simultaneously medication has given, that means concomitant medication has given. Or maybe they have discontinued, after that they have done the hospitalization. Or maybe let's say the person is suffering with a side effect of stomach ache, or maybe let's say headache. So maybe non-drug treatment, like any painkillers, and maybe they have applied some move, or maybe some amrutanjan bomb they have applied on the foreheads and all. Those things will become under non-drug treatments. Otherwise, specify any below. Any of these has not taken action. What is the other reason? Finally, outcome is that adverse event is resolved or not resolved, or stabilized, unknown, or is still that particular adverse event ongoing, and all the information you can able to get it in this. So this is all that CRF will talk about. What are the different data sets, and how the data sets information is coming into the data sets. You can able to get it. This is the source. If DM data set, they are collecting here in the CRF. AE data set, the AE information is collected in the CRF. So each CRF is going to be, each CRF page is going to be one data set for you in your real time. So this is all about how you need to use a CRF, and what information you will get it from the CRF, you will get to know.